Menopause is a natural process. It's a time of change. A lot of women suffer in silence because of the undesired symptoms and consequences of menopause. There are short-term effects like hot flushes, mood changes, irritability, dryness of skin, vaginal dryness, and decreased sex desire. There are many long-term effects, namely osteoporosis, where the bones become brittle with increased risk of fracture. Today, Dr. Tawfiq will tell us why these changes happen.
At the time of change, it's when the ovary stops working. The ovary is a gland in the body like many other glands, for example, the thyroid, which most people are familiar with, which produces thyroxine, or the pancreas, which produces insulin. The difference with the ovary is that it not only produces the hormones that the female requires, it also produces the eggs in the fertile years. But the difference between ovary and other glands is that the timeline of the ovary stops way before. So the thyroid and the pancreas will be working all your lifetime, while the ovary stops usually around the age of 50, and this is the time of change. All the consequences of having no estrogen produced by the ovary, as Dr. Mussarrat has just discussed and described, are very common, and we need to change that. And to change that is to give hormone replacement therapy, just like when people need thyroxine, we give them thyroxine, or insulin, we give them insulin. It reverses the time of change, so the woman would feel exactly as she was before. So all the symptoms, mainly the hot flushes, the irritability, the headaches, the dry skin, and so on, will all be reversed. And the quality of life is totally improved, and women feel themselves again. So hormone replacement therapy is very much wanted and very much needed.
Are there any side effects of hormonal replacement therapy?
Yes, definitely. In the past, we used to give the hormone replacement therapy as a combination of estrogen and progesterone with a pill, and this combination in the oral form slightly increases the risk of breast cancer. Now, the risk of breast cancer is slightly increased, but it is blown out of proportion. The actual increase is about 8 per 1,000 over a 5 years period. But some people find this is too much to take, and they would like to reduce that risk. The other thing, there's a small risk of deep vein thrombosis with this combination. But nowadays, we can tailor-make the use of hormone replacement therapy in a way to minimize the increased risk and actually to have a zero increase in risk with regards to the risk of breast cancer or the risk of deep vein thrombosis. And this is when you separate the administration of estrogen and progesterone in separate routes.
Please tell us more about this new transdermal hormonal replacement route.
Well, if we give estrogen on the skin, for example, by the way of gel or patches or under the skin in pellets form, this does not increase the risk of deep vein thrombosis for definite, and if we protect the uterus with local progesterone, it does not increase the risk of breast cancer. And this is how we tailor-make the use of hormone replacement therapy to people without increasing the risks of the side effects. But the thing is, we need to look at hormone replacement therapy as an overall improvement in lifestyle and the quality of life that we get with giving the hormone replacement therapy versus the possible risk. So our job is to tailor-make the treatment with the minimal side effects or the minimal risks with the maximum benefits, and to improve the quality of life of women.
Ladies, all women can have excellent quality of life even after the age of 50. So this is the time that you go to your doctor and talk about hormonal replacement therapy and how it will suit you.